Bismillahirrahmanirrahim. So today we are going to study about the vasculitis or arthritis, which is called the polyarteritis nodosa. So सबसे पहले इसके नाम पर अगर गौर करें तो इसमें तीन लफ्ज़ है पोली आर्थराइटिस नोडोसा. पोली मीन many, arthritis mean inflammation of the arteries, and nodosa means it is derived from the word nodes because nodes are formed in such kind of arthritis or polyarteritis nodosa. So coming towards its definition, so it is a necrotizing vasculitis. Necrotizing mean that necrosis occurs in the vessels. It is a necrotizing vasculitis involving mostly the renal arteries and other visceral arteries or vessel except pulmonary vessels. It is a necrotizing vasculitis involving the renal arteries and the other visceral arteries except the pulmonary vessel. This point is important because the pulmonary vessel circulation is pure from the polyarteritis nodosa. We cannot see such kind of arthritis in the pulmonary circulation. Now coming towards its classification, that in which group it is classified, whether it classified in the large vessel vasculitis, medium vessel vasculitis. So we can see that the polyarteritis nodosa belong to the medium vessel vasculitis. So it mainly involves the arteries which are of medium size. For example, the renal arteries and most of the arteries which जो क्या करते हैं, विजरा को सप्लाई करते हैं. Now coming towards its cause, so its main cause is mainly due to the formation of the immune complex, and when this immune complex deposits in the arteries, they cause inflammation. Now what this immune complex is made up of, ये किस चीज़ से बना होता है, तो मेनली जो पोलीआर्थराइटिस नोडोसा है ये पोस्ट इन्फ्लुएंजा पोस्ट हेपेटाइटिस इन्फेक्शन होता है कि मेनली ये हेपेटाइटिस के इन्फेक्शन के बाद क्या होता है, ये पोलीआर्थराइटिस नोडोसा होता है. तो जो मेनली इम्यून कम्प्लेक्स होते हैं वो क्या होते हैं, हेपेटाइटिस बी सरफेस एंटीजन, and the antibodies formed against these which are called hepatitis B surface antigen antibodies. Hepatitis B surface antigen antibodies. तो मेनली जो है ये पोलीआर्थराइटिस नोडोसा, इसमें क्या होते हैं कि इसमें ये जो है एंटीजन एंटीबॉडी मिलकर इम्यून कम्प्लेक्स बनाते हैं और ये इम्यून कम्प्लेक्स फिर आर्टरीज में डिपॉजिट होकर इन्फ्लेमेशन काज करता है. Coming towards the population at risk, so mainly the young adults are mostly infected, or we can say that they are involved in the polyarteritis nodosa, young adults. बात करते हैं क्लिनिकल फॉइंडिंग्स की, तो these clinical findings are only episodic. Episodic mean that the clinical findings comes for a short time and then fades, then again comes and then fades again. And though it involves the non-specific symptoms like fever, headache, or muscle pain, etc., and the specific symptoms due to involvement of the specific arteries like hypertension due to involvement of the renal arteries, and this renal involvement is the most common cause of death due to the polyarteritis nodosa. The second one is the abdominal pain and the bloody stools due to involvement of the abdominal artery, and the third one is the peripheral neuritis. It's an important point, the peripheral neuritis, and this peripheral neuritis mostly affect the motor nerves. So there is क्या होता है, problem in movement or motion. There is non-specific, or we can say non-required movements. There is peripheral neuritis affecting mostly the motor nerves. बात करते हैं मॉर्फोलॉजी के बारे में, तो जैसा हम हमारा मेथड है, हम मॉर्फोलॉजी में दोनों ग्रास और हिस्टोपैथोलॉजी डिस्कस करते हैं। तो सबसे पहले ग्रास के बारे में बात करें तो अगर ग्रास हम देख ले तो पोलीआर्थराइटिस नोडोसा जिन आर्टरीज को इन्वॉल्व करता है तो इनकी अपेयरेंस ड्यू टू फॉर्मेशन ऑफ नोड्यूल्स, जिस तरह हमने पहले डिस्कस कर चुका है कि नोड्यूल्स में बनते हैं। तो द आर्टरीज हैव tiny bedded nodules, and this can be seen mostly at the bifurcations and at the branching points. आर्टरीज में जहाँ पर बाइफरकेशन होती है फॉर एग्जांपल, और जहाँ पर ब्रांचिंग पॉइंट और ब्रांचिंग जहाँ से ब्रांच राइज होते हैं तो वहाँ पर क्या होता है, टीनी बेडेड मीन लाइक ए बीड्स नोड्यूल्स होते हैं, एंड दिस नोड्यूल्स गिव द स्ट्रिंग ऑफ फर्ल अफेरेंस। स्ट्रिंग ऑफ फर्ल अफेरेंस, एज यू कैन सी, this is the string having these folds. This is a string of fold appearance, and this is specific to polyarteritis nodosa. And this string of fold appearance is due to the alternative aneurysm and fibrosis in the vessel. Aneurysm weaks the blood vessels, and the fibrosis cause the formation of nodules. So there will be, and it occurs because the lesions in the polyarteritis nodosa are not in the same stage, they are at many stages. Some occur at the level of healing, some occur at the level of inflammation, active inflammation, some are at the level of already healed stages. So there are many stages of the lesions in the polyarteritis nodosa. So this can cause the alternative aneurysm and fibrosis in vessel, which give rise to string of fold appearance. Moving toward the microscopic features, so the lesions are at different stages as I have already discussed, and they may be in the acute stage, in the healing stage, and already healed stage. In the healing stage, they are characterized by the fibrinide necrosis in the media. Here is mostly fibrinide necrosis in the media, as you can see, is the media, and here is the fibrinide necrosis. The second important point in the acute state is that there may be transmural acute inflammation around this fibrinide necrosis, and this acute inflammation consists of inflammatory cells like neutrophils, eosinophils, etc. There is transmural acute inflammation around this fibrinide necrosis. As you can see, this is the infiltration of these cells. The third important point is that there is thrombus in the lumen. And this also you can see the thrombus which is present in the lumen. This is the thrombus. The fourth important point in the acute stage is that this transmural acute inflammation can lead to the formation of aneurysm in the blood vessels. Now coming towards the second stage, which is called the healing stage. So some lesions are in the acute stage characterized by fibrinide necrosis, transmural acute inflammation, thrombus in the lumen and the aneurysm, and some are in the stage of healing. And this healing stage is characterized by the marked fibroblast proliferation, and this fibroblast cause the secretion of fibers or collagen, etc., leading to formation of nodules. So the names polyarteritis nodosa, nodules. This is due to the formation of nodules. Now the third stage is the healed stage. So in the healed stage, it is characterized by the thickened overall arterial wall, arterial wall, and this is due to the much marked fibrosis, much marked fibrosis, much more than involved in the healing stage. And also there is the fragmentation or loss of the fragmentation or loss of internal elastic lamina. So there is fragmentation or loss of the internal elastic lamina. You can see again there is the pulmonary necrosis, here is thrombus, and there are the neutrophils or the inflammatory cells infiltration. In this slide you can also see that there is the fragmentation of the internal elastic lamina, fragmentation of the internal elastic lamina, and marked fibrosis in what, in the throughout the wall.